Eye bag removal or filler? Hi, I'm considering eye bag removal or filler for my under eye hollows. Please, could you look at my picture and tell me what you think I need to correct my problem? Thanks.
Thank you for your question. You've submitted a single photo, a close-up of your eye, and you're looking towards the outer corner of your eye, and you're asking, you were aware that you have some puffiness, and you're asking whether or not to do surgery or to do a filler under the eyes. So I'll explain to you how we make our decisions in our practice. I'm a cosmetic oculofacial plastic surgeon practicing in Manhattan and Long Island for over 20 years. And this question comes up a lot because there's increased awareness of the role of fillers to try to soften the appearance of under eye bags. So how do we make this decision when we see our patients? Well, first let's understand, why are your eyes puffy? Your eyes are puffy because there are fat pockets under the eyes that we refer to as extraconal fat or preseptal, postseptal fat. And this fat is normally behind a structure called the septum, and it's pushed back. Now, a combination of factors associated with genetics and the general accepted understanding is the septum thins, which results in the fat pushing forward, as well as an increase in volume that causes these bulges. Traditionally, when someone has puffiness under their eyes that does not get better, regardless of sleep and other things associated with tired-looking eyes, we generally recommend some type of lower eyelid surgery. And the reason is that it's a definitive procedure. It allows for a long-term correction of an anatomic issue where the puffiness is fat that's herniated forward. We call it herniated fat. Now, reality is that a lot of people have timelines where maybe they can't do something in within the next 6 months to a year, and they want something to make the area look better. This is where a discussion comes up as to what the expectations will be. I tend to be very conservative. As a specialist in oculofacial plastic surgery, I get to see a lot of patients who've had way too much filler placed, and it makes their eyes look even more puffy. A lot of times it's from non-surgeons, people who can't do surgery and want to still help their patients, but get a little too overzealous and put way too much filler, and they end up looking very, very swollen. What I do is I try to soften the transition between the bulge and the adjacent trough or valley. And so by doing that, we can soften that transition. And we use a filler like Restylane. We often combine this filler with platelet-rich plasma. Platelet-rich plasma is derived from your own blood, and I find that when I combine this with Restylane, I get a very nice softening of this area that looks very natural. A lot of times people are concerned about bumps and irregularities because these hyaluronic acid fillers tend to have some real gel-like quality, and it makes them kind of thick. And when we combine this with platelet-rich plasma, the platelet-rich plasma seems to work with the skin and kind of soften and integrate the material in a way that it seems to work out well in our practice. Plus, the benefits of platelet-rich plasma includes generation of collagen, improvement in skin quality, improvement in blood supply. So the global area of the lower eyelid also improves. So beyond a certain threshold, there is no value to fillers. That's just the reality. People try to hold off having surgery. Many times people are afraid of having surgery, and so they'll keep going for fillers. And when people come to us and I show them examples of our before and after patients and show like how people look at about a week, they're often surprised to see that many of our patients within a week after lower eyelid surgery will actually have less swelling and bruising than many people have when they have injections for fillers. And so that being one obstacle that people are concerned about, we actually meet that concern. The other concern is about the way the surgery is done. When we do lower eyelid blepharoplasty, we don't use general anesthesia, so patients are less afraid about going in on a respirator and having invasive surgery. We do the procedures in our office under local anesthesia with light sedation, so it becomes closer to the injectable experience, even though it is still real surgery. Based on this discussion, I think you should meet with experienced cosmetic surgeons who specialize in the eye area. That's a personal bias, and I think that this is an area that's very delicate, and you should go to doctors who really work in this area a lot and do have both the skills to do the surgery as well as the skills to do the injectables, and then figure out a plan that works for you. Judging by the photo, the fact that with you looking towards the outer corner of your eye, you can see that bulge of the fat in the outer aspect. That's the lateral fat pocket. If it's bulging that significantly, then chances are you'll probably get more value and benefit in having the more definitive procedure, a surgical procedure, but that doesn't understate the possible need to address volume adjacent to this area. You know, youthful and good, nice-looking eyes have the absence of puffiness as well as nice volume in the eyelid and cheek area. So it is, as always, cosmetic procedures there's a science and, of course, an art to doing them. So I hope that was helpful. I wish you the best of luck, and thank you for your question.